Good afternoon. So it's time, the Dr. Zhang's block time to discuss some subjects of our common interest. Today, actually, I would like to discuss with you all about an old subject regarding PGS or NGS or PGD. Several months ago, we had a session discussed about, general speaking, PGS, so-called pre-implantation genetic screen test of embryos and pre-implantation genetic diagnosis of embryos, so-called PGD and PGS. Today, I would like to spend more time to discuss a few more subjects about the same subject of PGS. And as I defined in the previous blog, that PGS standing for pre-implantation genetic screen test. So I would like to spend some more time today to discuss it with you all. Now, before I start, I just want to emphasize that we are privileged to have the chance to have a close collaboration with two of the largest pre-implantation genetic screen test lab in the country for the last 10 years. And one lab is called Repro Genetic Lab, and it's a Repro Genetic Lab. And another lab we've been collaborating for a long time is called Genesis Lab. So Genesis Lab and New Hope Fertility Lab have been collaborating doing the PGD, PGS for the last 12 years. So we're very happy that we have such a strong collaboration with the two best PGS lab in the country, actually in the world. Indeed, some of the information, the charts I'm going to show to you is part of our collaborative results, and some of the results actually also come from their study from the Repro Genetic Lab and the Genesis. So PGS become a very, very common used technique in infertility treatment. In many centers, including our center, and PGS is really become part of the routine in the fertility treatment. Today, I just want to emphasize the importance and how useful the technique for the patient with low ovarian reserve or with advanced maternal age. One of the obstacles in the fertility treatment is that not only is it sometimes hard to get pregnant, but difficult to keep the pregnancy. And now we know most of the time is due to the increased chromosome abnormality of the embryo, and that's why I need the PGS to screen out these embryos. So look at this data. I already explained this data before, but I just want to show this is large data we accumulate with the Genesis Lab and New Hope. As you can see, with the increase of the age from 35 years old, go all the way to 44 years old. And as you can see, after age 35, every 2 years, from 35 to 36, 37 to 38, every year, more than 5% of embryo will show abnormal chromosomes. And that's the reason why this genetic screen test is very important. So-called pre-implantation genetic screen test. I just want to emphasize what exactly PGS. PGS standing for pre-implantation genetic screen test, PGS. So I only want to focus on this subject to see how to benefit and what's the best strategic plan for the lady from the age of 39 to 42 years old. Because at the age of 39 to 42 years old, about 71 to 85% of your embryos will be genetically abnormal. So it's very important to screen this embryo out. And it also, due to the fact that such a high percentage of embryo will be abnormal, that means statistically, we needed to create more embryos with hope that one or two embryo will be normal. And that's why the concept of embryo banking is very important. Because just to take the lady at the age of 41 years old as an example, and this is the date which compiled from reproduce genetic lab. As I said, that's one of our long-term collaborate. So you can see every cycle, first cycle, second cycle's IVF, third cycle IVF, every cycle you can have a quarter of a chance to have a normal embryo to be found. So that's why if you do more cycles, you accumulate more eggs, you have a better chance to find one embryo normal. So that's why very important to do the few cycles and to get more embryos than do the genetic screening test. So the advantage by doing so is that actually going to save your time, less time to pregnancy. Why? Because you have low chance to go through embryo transfer, not getting pregnant, waste time on embryo transfer, and you also have a very high miscarriage rate at the age of 41 years old. So if you can avoid this kind of pregnancies, you save time. So overall, you'll be moving much faster towards a healthy life pregnancy. That's what that means. Less time to the pregnancy. Number two, no risk to the patient. You have much lower chance to have a miscarriage, and less cost to the PGD, because with the increase of technology now, embryo can be tested individually, not go through the batch. This is the first part of my conversation. And the second part of the conversation was that most of patients eventually give up after 1 or 2 cycles if they're not getting pregnant in the group of 40 to 42 years old. But if they do genetic testing, because most patients will have a chance to get pregnant about 60%. That's why most patients will complete the treatment and get pregnant. So if the embryo is genetically normal, and what's the chance this embryo is going to make a baby? Let's look at this graph. This is the data from our center from 2014 to 2015. As you can see, this is a bar shows the chance of the patient get pregnant with the increase of the age from 35 to 46. This is the data show if the embryo was genetically screened, they have a much higher chance to get pregnant. And that's the reason why in our center, and this is a very well established technique. The best strategic plan for the lady at age 39 to 42, or they are less than 39 years old, but they have a very low ovarian reserve. The best strategic plan will be gentle medicine, because usually this group of patients do not make many eggs, and they're definitely not making many good quality eggs. So I would recommend going through a gentle approach called minimal stimulation protocol, meaning that instead you're taking oral pills, but with a very few injections, gentle stimulation, make a few eggs, but with the hope of better quality eggs, rather than go through a conventional IVF, going through a heavily daily injection, which most of the time will not make more good quality eggs, it may also compromise the quality of the eggs. Number two, perform embryo banking and save the embryo for the genetic screening test. And this is the best strategic plan for the patient at age 39 to 42 or with a low ovarian reserve. Thank you.